Hi, this is Michael Altos, and we are continuing our discussion of herbal remedies and dietary supplements, and this is part 2. The next herbal medication we will discuss is ginseng, which acts as a sympathomimetic drug. It also inhibits platelet activity and lowers blood glucose. Patients take ginseng as a mood enhancer and antioxidant. Side effects of ginseng include increased risk of bleeding, and as usual, caution should be exercised in patients who take antiplatelet or anticoagulant medications. Ginseng may also decrease the effect of warfarin, in other words, increasing your risk of clotting. Ginseng can cause tachycardia and hypertension, and this is due to its sympathomimetic activity, as well as sleeplessness and mania. There's risk of hypoglycemia, and as you might guess, because of its sympathomimetic actions, it may interact with monoamine oxidase inhibitors. Ginseng should be stopped 7 days before surgery. Ephedra has both direct and indirect sympathomimetic activity. Patients take it as a diet aid, a stimulant, and a bronchodilator. Severe side effects include myocardial ischemia, stroke, and hypertension, and an increased risk of ventricular arrhythmias, especially when patients are administered halothane. It may interact with monoamine oxidase inhibitors and can also lead to depletion of endogenous catecholamines when taken chronically. Ephedra should be stopped at least 24 hours before surgery. Kava is a sedative that acts via the GABA pathway, and it potentiates GABA, leading to sedation and anxiolysis. It also potentiates other sedatives, and so patients may experience increased sedation, especially in the setting of receiving benzodiazepines or other sedatives. However, patients may have increased anesthetic requirements due to chronic use of Kava. Not surprisingly, patients can become dependent on Kava. They can abuse it and experience a withdrawal syndrome when they stop using it abruptly after chronic use. Kava has some risk of hepatotoxicity, as well as Parkinsonian or other dystonic-like reactions. It should be stopped at least 24 hours before surgery, although in patients who are dependent, this may be more complicated. Valerian is another sedative that potentiates the GABA pathway, used as a sedative or an anxiolytic. It also potentiates other sedatives, and similarly to Kava, it will increase sedation, with the caveat that patients who use it chronically may have an increased anesthetic requirement. It also has the possibility of dependence, abuse, and withdrawal, and we recommend stopping Valerian 2 weeks before surgery, although data is lacking to back up this recommendation. Vitamin E inhibits platelet aggregation and also antagonizes vitamin K-dependent clotting factors. Patients take it to prevent stroke, MI, and in the treatment of atherosclerosis, and also as an antioxidant. Not surprisingly, vitamin E is associated with increased risk of bleeding, and caution should be exercised in patients who are taking antiplatelet or anticoagulant medications. Vitamin E should be stopped 2 weeks before surgery. Fish oil is usually taken because of its omega-3 fatty acid content. It inhibits platelet aggregation, and so patients take it in the treatment of coronary artery disease, as well as hypertension and high cholesterol, and it's also used for its anti-inflammatory actions. Fish oil increases patients' risk of bleeding, and once again, caution should be exercised in those patients who are taking antiplatelet or anticoagulant medications. Fish oil should be stopped 2 weeks before surgery. Glucosamine and chondroitin are components of the proteoglycan that exists in cartilage. Patients take it for the treatment of osteoarthritis. Some studies suggest that it may cause or even worsen diabetes. And there are some studies that show there may be increased risk of bleeding when taken together with warfarin. Some studies recommend stopping these substances 2 weeks before surgery. Garlic, which patients can take in the food form or in pill form, inhibits platelet aggregation. Patients take it for prevention of MI and stroke, as well as to lower blood pressure and serum lipids. There is increased risk of bleeding, and therefore caution should be exercised in patients who are taking antiplatelet or anticoagulant medications. And garlic should be stopped patients can eat garlic, but shouldn't be taking it therapeutically for 7 to 14 days prior to surgery. Ginko biloba acts by inhibiting platelet activating factor. Patients take it for claudication, which is sort of like angina of the leg. It's pain in the leg that comes from inadequate blood supply, and it usually occurs during walking and resolves with rest. By inhibiting platelet activating factor, Ginkgo can improve the viscosity of the blood and improve tissue perfusion. Patients also take it for its antioxidant properties and to try to prevent dementia. Ginkgo carries some increased risk of bleeding, especially in patients who are taking antiplatelet or anticoagulant medications. They may also experience GI upset or headache, and it should be stopped 1 to 2 days before surgery. Those are the most commonly encountered herbal medications and supplements. Please let me know if you have any questions, and that concludes our discussion.